Happy Sunday, everyone. I hope everyone has had a chance to get outside on this beautiful weekend. I got to have a great weekend with family. I had one of my sisters visiting from Iowa, and so five of my seven sisters and I were together this weekend with nieces and nephews, and I had a great time. So now I'm kind of paying for it in getting everything done today to get posted on Blackboard. So sorry for the delay on this. But we are going to cover chapter 6 this week, and this is going to cover the health of younger adults. And I do apologize, my PowerPoint does not always match up with what I'm saying. So um, there are only two main topics for discussion this week, and that is the leading global causes of mortality, morbidity, and disability in young adults, including the difference between genders, and then we'll briefly cover reproductive health of young adults. As you can see, we're kind of moving up the age ladder. Last week we had health of children. Next week we'll have health of older adults. So here we're covering more of the population within most of the classes demographic. No, went the wrong way there. Okay, health in early adulthood. Really, there's only two main causes that affect health in adolescents and young adults. And for the sake of grouping them into an age, it will be those aged 10 to 24. It seems like these two causes are pretty universal. There's a little bit of variability due to gender and geographic location, but the primary causes of mortality, morbidity, and disability in young adults are pretty much the same globally, and that is mental health disorders and injuries. So mental health, we could spend the rest of this class. Again, this is one of these topics that is so deep that we're not even really scratching the surface in this class. We could devote an entire class to nothing but mental health. There's many topics inside mental health that we need to discuss. The first of which is the stigma that is attached to mental health disorders. This can lead to a lack of diagnosis and treatment. There are many places, certainly within Idaho, within the United States, and especially globally, that are just simply not equipped to handle mental health issues in a timely or appropriate manner. In some places, there really is no access to mental health care. So worldwide, more than 450 million people have a diagnosed psychiatric disorder. Notice I said diagnosed. Many people that have psychiatric disorders, because of that stigma, have not been diagnosed or have not seen any kind of medical professional. Idaho, sadly, is ranked 42nd in the nation for mental health care. That is really sad. We were the last state in the nation, I believe, to get a suicide prevention hotline in place. So that kind of tells you where we are on the map as far as mental health care. There's certainly definite risks involved for developing psychiatric disorders, and I don't want to say that these are a cause, but they can exacerbate symptoms that are already there, or the predisposition for mental health issues. So risk factors, of course, include living in poverty, experience a conflict or disaster, so war, natural disasters, having a major physical disease, so these would include things like Alzheimer's, Parkinson's. In developing countries, we have so many people with mental health disorders, and yet in those developing countries, so those that are poorer nations than ours, there may only be one mental health professional for more than 100,000 people. Can you imagine what that must be like? And I think that's one reason why many of these disorders are diagnosed in these developing countries, And if they are diagnosed, they simply just don't have access to the help they need. So, boy, I'm batting 1,000 here with my slideshow. So, mental health, historically, those with mental health conditions have not been treated very well. We have kept them in institutions involuntarily. They may have been imprisoned, denied access to any type of care, been subject to physical and sexual abuse, and been used for slave labor. I'd like to say that we're coming quite a ways, not nearly where we should be with this. So this is where I get really passionate about it. So mental health issues are so predominant in young adults because, and I don't want to say again that this is the cause of it, but puberty can exacerbate symptoms. And I would like you to think about yourself at about age 12 and some of the struggles that most of us go through. You've got that struggle of body image, struggling with your identity, the pressure to fit in. Added to that, your hormones are just going crazy. You don't know which end is up. Everything is so serious and so life-altering. That's how we perceive it at that time. So due to those hormonal fluctuations and the presence of stressors that may not have been present in childhood, compounded with the access to drug and alcohol in young adults, it really can trigger some of these underlying symptoms that someone may have had and the symptoms may not have manifested until adolescence because of these hormonal fluctuations and these additional stressors. In addition, drug and alcohol abuse can trigger those underlying symptoms and is often used to self-medicate. One with a psychiatric disorder may feel like something is just not right and they can't pinpoint it. They may be more apt to engage in substance abuse because it kind of dulls that pain or numbs that feeling. You don't know what you're fighting, but you know it's not right. So again, we could talk for days, for the entire semester about mental health, and it's one of those things that I feel very passionate about. Obviously, most of the subjects in this class I feel very passionate about, but I think what we will do for discussion questions, maybe not discussion questions, I think our perception paper this week will be addressing mental health and maybe looking at it in a local and national and global perspective. So moving on, injuries. Gender does play a part in injuries. Males do have a higher likelihood of death than young women due to the fact that they are more likely to engage in hazardous occupations. They may be in armed combat. They may participate in dangerous recreational activities. However, women may be more likely to experience domestic and sexual abuse. Sadly, yes, gender does play a part in injuries, and we will be discussing injuries in our discussion question this week. So we're going to lighten up our discussion question a bit and put more of the weight for our subjectivity and passion into our perspective paper. Again, brief paper, probably 2 paragraphs. Injuries continued. So I want you to think about it, and this will, again, morph into our discussion questions. So what kind of injuries do you think are common for young adults? Obviously, car accidents are a leading cause of injuries. Also, sports and recreational injuries. I'm sure many of us, and even though I am well past this age group that we're talking about, many people are physically active. We may engage in sports such as volleyball or gymnastics or even running, where we are much more prone to developing an injury than we would be if we were sedentary, which does not mean that we should be sedentary. It simply means that we are more likely to suffer an injury due to sports or recreation when we're younger. Also, there are those self-inflicted injuries. Going back to the mental health discussion just for a bit, in some psychiatric disorders, self-harm is a common result of some of these disorders, and people may cut or slice or carve themselves. And then, of course, we can look at suicide and those self-inflicted injuries that those with a psychiatric disorder may inflict upon themselves. So going into reproductive health, the first thing that needs to be said about reproductive health is that it is a lifetime thing. Just because one has not either entered into their reproductive years or has passed their reproductive years does not mean that reproductive health has ceased or that you should no longer pay attention to it. So reproductive health includes both men and women, and it includes such issues such as safe sex, prevention and treatment of STIs, sexually transmitted infections, fertility and infertility, sexual health, pregnancy and childbirth. And along with those, any hormonal type of issue, again, going back to adolescence and how those hormones are just fluctuating and a little bit out of whack at that time. Also in later years, after one ceases to have ceases to be in their reproductive years, then you may again have that hormonal fluctuation. And this will happen to both men and women. You know, we hear the term menopause and perimenopause. Definitely that is something that is only applicable to women. I'm sorry, I'm having a lot of trouble trying to get my thoughts across today. However, men do suffer a dip in testosterone levels, much like women suffer a dip in estrogen levels. So in some form of this hormonal dip, men do suffer from something similar to menopause, although in a different way, obviously. Men don't have ovaries, so it should be said that, you know, this reproductive health and this dip in hormones is something that both men and women should pay attention to. So that is it for the PowerPoint for this week. I'm sorry I kind of struggled to get my point across. I've had a couple of really late nights having way too much fun with my family. I hope everyone has a great week. Things to just be aware of. Again, we'll have discussion questions. We'll focus on injuries on that. You will have a My Perspective paper that will cover mental health disorders and your thoughts on that. A huge thank you and shout out to everyone for their participation in the discussion boards this last week. Very passionate, very heartfelt, thoughtful posts out there. I appreciate the respect that everyone showed one another and the level of maturity that everyone showed in discussing such a controversial topic as vaccination. So please keep up the good work. I'm not one to usually count down, but at the end of week 6, we will be through 1/3 of this class. So fall is coming. You'd never know it by today. Enjoy this weather. Have a great week, everyone. And if any questions, please feel free to email me or post your questions on the Ask My Instructor board on Blackboard. Thanks, everyone.